Hi, I'm Preston Carter. I will be presenting on the lead poisoning crisis in Zamfara, Nigeria. So, takeaways from this presentation will be to have an overall understanding that economic development can be a driving factor for public health crises. Also, to have an understanding of how the impact of lead poisoning specifically can cause for children, specifically in neurological development. Also, identifying elements of the global public health response to the outbreak in Zamfara. So I will be addressing a little bit of background on the crisis. I will also be addressing soil lead concentration levels. I will also be addressing the relationship lead poisoning has specifically to children. I will also be discussing the remediation process in Zamfara, specifically with the soil, and then a brief summary. So in 2010, a lead poisoning outbreak in Zamfara State, Nigeria became one of the largest lead poisoning acute outbreaks ever reported in literature. The increased extraction of gold through artisanal gold mining led to rising levels of lead in the soil. And this is an image of the map of the Anka local government, which is a part of Zamfara State, and it's broken up into three views. So the first view on the top left is of the entire country of Nigeria, and it is highlighting Zamfara State in red. The map on the bottom left zooms in on Zamfara State, highlighting the Anka local government area, and the bigger map zooms in on the Anka local government area, highlighting the Doretta village and places where samplings of the soil were taken from. So next is soil lead concentration levels. So 3 years after the outbreak emerged and remediation measures were implemented, the soil levels were checked and published in a 2019 study. So the following table displays the soil levels in milligrams per kilograms. Samples were taken from a control site, which was a non-mining community nearby, to compare to the Doretta village, which was a mining community. And according to the data, many samples exceeded the limits for the US EPA, and their cap is 400 milligrams per kilogram. And all the samples were higher than the control village, which could suggest artisanal gold mining as a possible exposure to lead. Next is a visual of an ecological risk assessment, and it estimates soil lead concentration by average accumulation factor. And it revealed that if remediation attempts did not occur, soil lead levels would increase over the years to higher levels in different parts of the village. As you can see, it's showing years 2010 and projecting all the way to 2025. As you can see, it looks like Market Square would be increasing most, and that was where a lot of the mining was happening. So the next slide, we are focusing on children and the impact lead poisoning has on children. And in a study in 2014, they examined neurological features in 972 children who were living in Zamfara during the time of the outbreak. So the graph on this slide provides a comprehensive view of the distribution of lead levels by age. So one of the key points from the graph is that majority of all of the individuals in all of the age groups had a blood lead level in the 45 to 64.9 milligrams per deciliter category. There is also a decreasing trend of individuals with higher blood lead levels across all age groups. So for example, the as the categories of blood lead levels of milligrams per deciliter increase, you can see a trend of less children having blood lead levels that are increasing. Also, the 3 to 5 year age group has one of the largest number of individuals and the highest overall percentages in the 45 to 64.9 milligrams per deciliter category. The next slide uses the children from the same study, and this is a distribution of the neurological features, and they are categorized in 4 categories. They are categorized as no neurological features, mild neurological features, presumptive seizures, and severe neurological features. 91% of the children had no neurological features. 1% of children had mild neurological features. 5% of children had presumptive seizures, and 3% of the children had severe neurological features. So, like a standard outbreaks investigation, control measures were taken into place, and the control measures focused on children and mothers and also treating the contaminated soil. After the implementation of the methods, the implementation was considered a success, and the lead concentration decreased in the soil. So, to reiterate, an intense demand for economic development can lead to intense public health crises. Because mining was banned in some areas in Zamfara state, a lot of mining illegally occurred because people had no other way of getting money, and that led to no further improvement in the soil audit that was done in 2013. Lead poisoning also impacted infants the most, ages 1 through less than 2 years old, having the highest odds of neurological symptoms, and also a strong association of increasing blood lead levels with increased neurological features.